Now, we're going to the big area for me. First, we want to look at the budgetary allocation over the period, right? Comparing NDC and NPP periods, because it's all about track record on the subject. In 2009 and then 2006, we just picked 2 points to look at this. Of course, after the 2008 elections, at that time, it was 0.921, right?
Yeah.
And then we are talking about 2016, 4.9 billion.
Yeah.
That's an increase, right? It's 432% rise. So that's good. NDC comes in, MPP comes in at 4.2 billion, but now we are talking about, in the last budget that was read, 15.6 billion. What's your comment on this?
You see, comparing these numbers absolutely is a bit of a struggle because you have to factor in the exchange rate at the time, and that's why health expenditure per capita is always quoted in the United States.
Dollars, yeah.
So I tend to like to look at what's the health expenditure per capita currently and what are the health expenditure per capita track records. If you look at it, the highest health expenditure per capita Ghana has had was $111 to $113 per person per year, which was in 2015, and it was under the NDC. Currently, we are hovering around $93, $94 per person per year. The reason why that equates to 15.6 billion is because the dollar is about 16 cedis now, compared to a dollar that was about 4 or 5 cedis in 2016.
It's possible that you could have done more with 4.9 billion.
And apart from that, our population growth rate is 2.1%. It's slowed down a bit to 2.1%. It was 2.2% then. So you have to factor all those in. And that is why, to level them all up, I look at the per capita. And if I look at the per capita, you'd realize that, and anyone can go and check it because it's on the WHO website, you realize that the NDC were consistent with the per capita. The NPP have been spiking and dropping. At a point, they dropped to $67. They've come up to almost $100 now, which is a good thing. But it blows it up to that figure, not because they are putting more money in dollar terms, especially when 80 to 85% of our health system is dollar indexed, but because our money has collapsed.
That's an important point. Now to the big picture for me. So you, as CDD, costed the manifestos. Something that we don't do, but you have taken time to put this together for us to appreciate what is going to cost the NPP and the NDC to implement their manifestos. Yes. And you've said, for the NDC, with their 111 promises, they're going to cost them $18.5 billion.
Yes.
That's jaw-dropping for 4 years. For
4 years. So if you divide it, it's about $4.5 billion US a year. And you have to factor it in that a chunk is the earlier calculation I made of the free primary health care because of the $50 average with 34 million people. So that is there. Even if in our calculation, what we did was we assumed that, let's say that they are going to even, only 50% of Ghanaians are going to access that. So the 1.7 billion just comes to about 850 million US. But that is still a lot of money a year to find.
Yeah.
Factoring in the fact that we need to find 3 billion and we are struggling and going cap in hand to the World Bank. So for me, they have to tell me. And one thing about numbers is when you tell them every time, what the political parties will do is to try and muddy the waters by saying, how did you come to this? I'm not going to play that game with them. What they should tell us, how much is it going to cost? If they say that is wrong, let's assume they came and said all this is wrong.
They should tell us.
They should tell us how much.
Because you put it up. You tell us how much it's going to cost.
Yes, and if they want to see the numbers and what has gone into the modeling to get to this, I'm prepared to share. But most importantly, they should tell us how it will cost. The NPPs would cost
13.9.
Yeah.
They are more realistic in what they are promising. You saw in the numbers there.
Even then, it's about 3.9 billion per year.
Per year.
They can't find 3 billion.
Yeah.
But then they are telling me that they will find 3.9 billion every year over 4 years. When they can't find, when they can't find 3 billion for
3 years,
for 1 year from the IMF.
IMF, yes.
Just to get.
I mean, the point
support.
you're making, we've gone to the IMF, wanting 3 billion
for the whole country.
For a 3-year period.
Which is 1 billion a year.
And now you say you're going to be spending 3 billion every year for 4 years.
4 years. So what I get is, as happens with a lot of our manifestos, it's a wish list. They would implement some of them irrespective of who wins power. But 4 years from now, we probably would be looking at the things they promised us that they never implemented. And that, for me, is what we are trying to prevent today. By them opening up to us, telling us where they're going to find the money from, looking at our budget deficit as per November, what they were telling us, the gap in our budget, and show us where the money is going to come from.
Especially at the time of economic crisis, as has been projected, it's probably going to take us a decade to recover. How are you going to find $18.5 billion for the NDC, $13.9 billion for the NPP to fund that manifesto over the 4-year period? You only have a 4-year mandate, and don't let them tell you, oh, 8 years. This is a 4-year mandate, and that promise, because in 2028, we expect them to come up with a new manifesto.
Yeah, they would.
So we are restricting them to the 4 years.
Unless, of course, something like the NPP is going to do, because now Agenda 111, which was in the 2020 manifesto, is now carrying forward into the 2024 manifesto, which means that they're expecting to fund over an 8-year period. If that is what they have to do, they also need to be upfront with us.
And tell us.
And tell us.
And tell us.
Because
Absolutely.
the manifesto, as far as we're concerned, is for a 4-year period.